Today we're honored to welcome Joseph Cilea to the show today. I'm very happy to have him on. He practices functional medicine. He talks about a lot of great topics today, and especially the field of regenerative medicine, which is like very new and emerging, and it's very beneficial for people. Today we're going to learn a lot about how to optimize our health and wellness, and this man right here is the person to teach us that. So I'm very excited. How are you today?
Hello, Anthony. How are you?
Doing great, man. As I said, like I'm very interested to hear your story and how you got into health and wellness and being of service today.
Sure, absolutely. I am a chiropractor by trade. I've been in practice almost 30 years now. Um, I became interested. I've always been a health and fitness person. I'm a former collegiate athlete. I played baseball in college at Villanova University. But prior to that, I've always been into fitness ever since I was probably 12 years old. I remember my dad getting my brother and I a first weight set one Christmas, and weightlifting and fitness was something I just took to. And I just, to this day, I'm 56 years old and I literally go to the gym every day, or at least try to do some type of fitness every day. So it's just part of my daily habits and routines. Um, so I took a class. What drove me into the profession. Once again, had a background in fitness. Always liked working out. Was an athlete, and I took a nutrition course, and I was really. It just really had an impact on me. It drove me further into the health field. Um, I just became really interested in eating better and learning more about nutrition. And then I was in my junior year at Villanova, and trying to figure out what my ultimate. Didn't really have a profession in mind at that point. I was definitely thinking about the health field. I was leaning towards orthopedic surgery. That was what my first thought was, and my aunt actually had worked for a chiropractor many years out on Long Island, and so I started it piqued my interest. I started learning about it, and the whole philosophy of chiropractic is that the body is ultimately a self-healing organism. All right, you cut your finger, it heals. You're exposed to bad food, you may throw up. Right, you have certain type of bacterial infection, you have fever. That ultimately works to as part of your immune system to battle organisms that are in your body. Um, so understanding that, it just kind of made sense to me. It kind of aligned with the type of health philosophy I had. I never, even prior to understanding more about the human body, I never was a proponent of medication. Now, my parent, if I was sick, when I was younger, my mother wanted to maybe give me some aspirin or Tylenol or cough medicine, and I just, for some reason, whether I was just being a kid or just instinctively, I was just like, I don't need this stuff. My body can take care of it. Right? Now, with that said, that doesn't mean there's not a time and place for medication. Right? Um, you know, you have a trauma, something, you have an injury where you get hit by a car, God forbid, or fall downstairs, and there's a place for medicine, right? Um, there's also a place for medicine in situations where, the body just can't handle it anymore, right? But the vast majority of healthcare visits, if you do the studies, is for self-limiting conditions, right? Things that are going to go away on their own, things that lifestyle change would take care of. And that's the fact, the vast majority, right? There are many diseases that require treatment, that the body cannot handle. But things like heart disease and different types of cancer, these things are all preventable. And basically, we've harbored these diseases with our lifestyles, right? Things that you do on a daily basis you're either moving in the direction of health or you're inviting sickness and disease into your life. Things like diabetes, type 2 diabetes, right? Highly linked to nutrition and processed foods and high sugar intake, heart disease, a lot of inflammatory foods that ultimately cause arterial inflammation, which ultimately leads to heart disease or heart dysfunction. So and obviously various cancers are either environmental or sometimes nutritionally based from either toxins or nutritional, toxins ultimately. So so that's kind of that was my journey into chiropractic. As I stated, I started to research the profession, visited the chiropractor, Dr. Goldberg, out on Long Island, and really that was it. I was kind of hooked. I was like, this is what I want to do. I want to promote and teach people how to be well versus treat sickness and disease, right? So been in practice 30 years, started with a chiropractic practice, just basically a solo practitioner, me, myself, and I. Eventually I was answering the phones, I was treating patients, hopefully in short time, I should say. Practice got busier, probably had a receptionist start, and then, little by little practice grew, an associate. Ultimately had the vision of creating a multi-specialty practice. Wanted to bring in other providers and create a more comprehensive, holistic approach where basically a one-stop shop, for a lack of a better term, a place where patients can go and not have to jump around to several different providers, could have it all under one roof. We started with adding a medical doctor and then a physical therapist, and then we ultimately moved into a different facility, and then we added acupuncture. Then we started getting into nutrition, and ultimately created a really successful weight loss program. And we've been doing weight loss for probably 10 years now. It's weight loss with more of a focus on functional medicine, basically finding deficiencies in people's bodies and ultimately restoring that so the body could ultimately work to its best potential. I'm not personally a functional medicine provider. I do have two providers in my office that handle that. So many people come in for weight loss, but ultimately we identify through lab work lots that's going on, whether it's hormones, nutrient deficiencies. And so in conjunction with ultimately changing people's diets, we use supplementation and weekly coaching visits to ultimately change people's lives. I mean, we got patients, many patients have lost well over 100 pounds, just changing lives on a daily basis. And ultimately, like I tell my staff, you're saving lives. Because many of these people, you get them off, in many instances, you get them off drugs, you're getting them down 50 to 100 pounds. So all the risk factors of high blood pressure, heart disease, diabetes, a lot of people reversing type 2 diabetes. So that's been a huge cornerstone of the practice. And we're a very, very progressive practice. We're always looking for the latest things that can help our patients. We try to stay in the orthopedic, typically the vast majority of our practice is more of a orthopedic pain management, rehabilitation type of practice. Chiropractors, physical therapists, occupational therapists, acupuncture. We have medical doctors, physician assistants, nurse practitioners. So it's once again, it's a one-stop shop. Patients come in, evaluation. We dive into not just, maybe they come in for knee pain, or maybe they come in for neck pain or back pain. We don't just look at that specific problem. We look at the patient from a holistic perspective, right? Many of these patients, yeah, they come in for, for a knee pain, like I said, or some type of joint ailment. And when you really sit down and dig down with these patients, the vast majority of times you find various other comorbidities that they come in with. Many of these people are, overweight or, have other health problems. So we try to create a treatment plan that's comprehensive and that's ultimately going to make them a healthier person. Now, unfortunately, many patients come in and health is not a priority for a lot of people, unfortunately. There are a lot of people their value systems are not, health is not kind of on the top 5, right? I mean, if you look at someone who goes to the gym on a regular basis, eats well, if you ask them what their top 3 to 5 priorities are, and that wellness and health and fitness would be up there, right? If you look at people who come in who are overweight and they smoke and they, eat like crap, and you ask them how important is your health, and sometimes it's not even top 10. It's quite astonishing. So a lot of times it just takes a little bit of motivation and trying to get people to see it. Some people weren't brought up in households that really educated them on health or put a value on health. So education is a huge component of this. Basically, just getting people to see that you are heading in the direction of disease. Like disease is not like a germ that you catch. Disease is something, and many health problems. Like I said, there's many that are not lifestyle. There's tons of, terrible situations where there's, childhood cancers and things of that nature that aren't lifestyle. But most people, literally, from the time they wake up, they're just promoting disease and sickness in their body. And it's incredible how the human body can still live 60, 70, 80 years with the abuse that we do to it, right? Some people, the old saying, you can't pick your grandparents, right? Because that's what it's genetics. Genetics are a huge component. You could have someone be a smoker and, develop lung cancer by age 40, right? And then you could have people who smoke 2 packs a day and they're living beyond 80 years old. So it's genetics is clearly probably the biggest factor, right? But going back, when patients come into our office, we try to get them to see this big picture and see, where were you 10 years ago? How many medications were you taking 10 years ago? Well, not many, maybe 1, all right? Now how many are you taking? Oh, well, I got a whole, I've got a whole regimen every day. I'm taking this for my thyroid. I'm taking this for high blood pressure. I'm taking this for, you name it. So when you when you shed light on that for people, and then you ask them the next question, where do you think you're going to be in the next 10 years? And so sometimes it just takes a little bit of, getting to, shedding light and showing them the path that they're on, And then sometimes it's important to get them to understand what's important in their life, right? Do you value your spouse? Do you value your kids? Do you value grandchildren, right? They have to have a big why for them to make a lifestyle change. And sometimes you got to just kind of put that in their face a little bit. Like, do you want to be around here for your grandkids? Because the way you're heading, you may not spend a whole lot of time with them, And so really establishing people's why and finding out, like, if people's why is big, then they'll find a way, right? If their why is not big, the effort is always relative to the why. The why is big, the effort will be big, right? If the why is not there, the effort's not going to be there. And as an example, I heard a story about a guy, he was obese, and his whole life he was battling obesity. He was well over 100 pounds overweight. And finally, his young daughter, developed a kidney issue and needed a kidney transplant. So they're trying to find a match. Turns out the father's a match, and the doctor's like, "Yeah, you're a match, but you're too much of a risk to do a kidney transplant, to take your kidney and give it to your daughter." Well, that guy's why went through the roof, right? Guy couldn't lose weight his whole life. The guy dropped 100 pounds, was able to do the surgery, and ultimately saved his daughter, right? So that's powerful right there. That's powerful. I had another patient once, came in, hadn't seen him in a while, lost a ton of weight, and I said, and he was in his 60s, actually probably in his 70s. But I said, "Wow, what did you do? You lost a ton of weight. You know, that's amazing. You look great." He's like, "Yeah, well, I'm sorry to say, my wife, has dementia, and I really need to be healthier for her. So I really had to get, I had a heart attack and, had some health issues." Once again, his why was there, right? He didn't have the why before because, health wasn't a priority for him. But when he had to take care of his wife, it became a priority. So, yeah, so that's kind of how we do things, and we try to change lives by lifestyle changes, motivation of people, trying to change their mindset and just kind of showing them that the path they're on is ultimately going to lead to sickness and disease, and that could be prevented. So, yeah.
That's amazing, man. I appreciate you sharing that. So many great insights in there. Like you started out saying how you got inspired by getting like this gym equipment, right? So you kind of started at a young age. Is that right?
Yeah, exactly.
Yeah. And from there,
I'll
like,
never forget it. It was a punching bag. It was a Joe Weider set of weights that had like plastic. You seem a little younger than me, but back they didn't have like the metal weights. They had these plastic weights that were like filled with cement. And yeah, so it was like a punching bag, a little mat, and a bench. And I was working out with my brother. My brother was 3 years older, so his buddies were like probably 15. So I was the little brother, and looking up to those guys. So yeah, that's where it all started for me.
yeah, those experiences when we're young can really shape us. So that's like something for parents to think about. Kind of like make health look awesome, right? Like make it like connected to their goals and like living a great life. I think that's an important tip as well.
Yeah, and like you said, it's upbringing. Some people just they were brought up in houses that either didn't value health, they weren't educated on health, because a lot of there's just not good education out there. I think people are well more educated now, but you're talking about 30, 40 years ago, my grandparents, people smoked more, people didn't eat as well. Although you could argue that way back then, grandparents' age, there wasn't as much processed foods. They ate a lot more whole foods, right? So, although they may have smoked more, but they probably had better diets all in because they were eating more whole foods. Now everything's packaged, quick, easy ways to get food in, and so. But yeah, I think it starts in the house, right? It's the value, it's the value system, it's the education, and you got to set the tone. I've got 4 kids. My kids age they're all grown now, 19 to 23, and from an early age, it was organic foods. There was no soda in the house. We obviously let them. I think I think my wife called it sugary cereal Saturday. Like maybe on Saturdays we let them eat a sugary cereal or something like that. But generally speaking, we just, since it's part of our lifestyle, they see us working out, going to the gym, and all my kids, they become a product of that. All my kids are fit, they're healthy, they eat well. Thank God they're healthy, and so we're healthy kids. It's all about what they see, right? It's the habits that you create in the household, and yeah, sometimes kids do their own thing, and it's not to say it's always works, but I think that more times than not, they're gonna do what they see and what they're used to. So
Absolutely, man. Like if we're the model of health, they're more likely to develop those habits, right? Because they honestly do what we do more than what we say. Is that right?
Oh yeah, absolutely, 100%. You know, they what they see is more powerful than what you say, and that goes for
Another
everything. That's not
thing
just
that you had
health.
mentioned is
That's working.
absolutely. You had
Can you repeat?
mentioned
Can you repeat that?
when you see patients, yeah, I think we're having a slight connection issue, but it's okay. I feel like
You said,
just as you
you said
mentioned, like
when
with
you
your
see the.
patients, you noticed
Mhm.
the ones that have a
Didn't hear
strong
that.
why were able to heal, right? Like the more reason you have for something, the easier it is to heal. Is that right?
Oh, 100%. 100%. Like I said, the why ultimately dictates the way. You know, when you have a strong why, you'll find a way.
The why
Little bit
dictates
of
the way. I really like that.
like I said, I say that, or I also say the bigger the why, the bigger the way. You know, if that why is not big enough, people aren't taking action. That's the bottom line, and that goes for everything. That goes for health. That goes for everything in life. I talk to my staff about that. Um, you know, if we don't want it bad enough, then we're not going to do what it takes to achieve it. And that's, like I said, that goes for health. That goes for uh, your professional career. That goes for athletics, right? I mean, I have a big sports background. Like I said, I played college baseball. My son plays college baseball. Um, you know, I see it with athletes, right? It's like they want they want to play at the high level, but are you willing to wake up and do the work, right? Are you willing to do the extra? You know, the average person is average, but to be good, you got to do a little bit more. To be great, you got to do even more, right? And that becomes now it's like nutrition, it's training, it's weight training, it's mindset, right? And then to be elite, it's just a whole nother level. Like when you see elite athletes or even elite performers, even in the business world, you know, I see it all the times. I see, you know, one of my favorite sayings is success leaves clues, right? Success leaves clues in all things. For athletics, you watch what the great guys do. They don't just, and granted, you got your LeBron James and you got your, you know, your outstanding, your Kobe Bryants and your Michael Jordans of the world, but you know, those are the outliers. You know, the most elite performers in athletics, in the business world. I tend to, like I said, success leaves clues. What are they doing? You know, follow them, model their habits. Healthy people, what are they doing? What are they eating? You know, what are their routines? You know, like I said, in anything in life, you follow people who are you know performing at a high level or doing things that ultimately you want to do.
100%. Just like if you want to be like super optimized in your wellness, yeah, you can do nutrition, exercise, right? But as you kind of mentioned, like there's all these different components for like professional athletes. Like, well, what are you doing for your health? Like, are you doing everything? Are you getting sunlight? Are you sleeping well? Are you managing stress? Like all these things kind of make up holistic health and wellness, right?
Oh, absolutely. Everything, everything matters, and obviously, you as an athlete, as an example, you want every possible edge. I mean, these guys will try things. I mean, there's a lot of things out there, and you know, things come and go, and they're like the flavor of the month or year. You know, like things like ice baths and stuff like that. I mean, the jury's out on things like that. I mean, obviously they're not going to harm you, but the question is can you really measure the benefits of it? You know, like there are studies out there, and they'll tell you that it does this and it does that, and But sometimes those benefits are so small, they're such small increments that it really isn't really moving the needle in the big scheme of things. But once again, when it comes to something holistic like that and something that's just natural, why not? Why not try it? Right? It's not going to hurt you. Um, it's when people are doing things that are questionable, maybe putting things into their body, um, but if it's something that's just totally natural, why not? Get rest, move your body, eat whole foods. I mean, it's really not rocket science. The things that, I read a book called The One Thing, and it basically was about, and most times if you want to achieve something, as an example, let's say weight loss, right? There's 10 things you can do to lose weight, right? There's supplementation, there's, you could even do acupuncture. Many people for suppressing appetites, and obviously you could eat well, but there's really one thing that's going to give you the weight loss result. That's going to give you probably 90% of the weight loss result, and that's going to be eating less and exercising more, right? That's the one thing you can do. So a lot of times, you could find the one thing that's really going to make the biggest difference. And all the other things, yeah, they'll help, but it's really the one thing that you have to find that's going to really give you 80% of the result.
Absolutely. Cultivate a standard of excellence, right? Because the thing that you need is going to be different from someone else. So really kind of find out what that thing is for you and execute.
100%. And sometimes it's just mind over matter. Some people, if they believe in that, there's got to be some component of placebo effect, but it's real, because your mindset, if it's something's going to change your mind in the sense that it gives you a routine, it gives you a feeling that, hey, I'm prepared now. I did my ice bath. I got grounded. I walked out. I got sunlight. I was in nature. Whatever the case, I meditated. If that's someone's routine that helps them wake up and feel like, hey, I'm prepared for the day. I'm prepared to take on today's challenge, whether it be an athletic event or going to work or whatever. So routines are powerful. And that's something that you'll see a lot of successful people, whether it be in business or, like I said, whether it be in health, or it's routines. They don't get up and just kind of haphazardly start their day, right? There's another book I read called The Millionaire's Morning, right? They talk about that. They talk about getting up, journaling, reading, doing exercise right away. Get some good nutrition in your body, as opposed to getting up, eating a bagel, maybe getting on social media and all getting your head in just the wrong place. So good morning routines and just good routines regardless throughout the day are vital for health, for your mental health, for your physical health. Routines are, in my opinion, extremely important.
Absolutely. Power routine is key, just as you mentioned. Is that by Lewis Howes, by the way?
Excuse me?
Is that from Lewis Howes?
I don't recall, to be honest with you. You
All
have to
right.
Google that.
Yeah. I may have read it.
I think it's called the Millionaire Morning, I believe. Yeah.
Yeah, he has
And
it.
then
Yeah.
I forget the author's names. A lot of these books. I remember the titles morning. The One Thing was great. The Millionaire Morning was great. Um, yeah.
So another thing you talk about is regenerative medicine. So you want to get into that, like any breakthroughs you see, anything you're excited about?
Absolutely. So, in line with the vitalistic philosophy of chiropractic, it's quite interesting that for years chiropractors have been talking about vitalism and how the body is always moving towards health. It's doing the best job it can. Your body's always trying to stay in a state of homeostasis, ultimately. And once again, it's a self-healing organism. You cut when you cut yourself, you don't have to hope that you're going to heal. The body is going to bring platelets to the area that's going to clot, and ultimately the body heals. Now, regenerative medicine is harnessing the body's healing potential. Regenerative medicine, so the two major things in regenerative medicine that we do in our office is platelet-rich plasma, also known as PRP. Became very popular. A lot of the athletes, Kobe Bryant did it. I believe Tiger Woods may have done it, but all the professional athletes are doing it. We've treated hundreds of athletes with this, and ultimately, it's putting your healing, it's supercharging your healing. So what you're doing is you're basically you're drawing blood. There's a very specific type of centrifuge that separates the plasma cells, which have a lot of platelets and growth factors. And these are the things that, like I said, when you do cut yourself, these are the things that are in the components of your blood, I should say, that go to the site of injury and create the healing. So what you're doing is you're taking these concentrated healing components of your blood, you're separating it so that it's concentrated, and then ultimately you're injecting it back into the place of injury. So if there's a tendon injury, or a tendon or a ligament injury, or a muscle injury, or a cartilage problem in the knee, you're injecting it to the site of injury, so you're allowing the body to accelerate. You're basically creating an accelerated form of your body's healing. So that's one of the things we do. The other treatment, the regenerative medicine treatment we do is stem cells. Stem cells are also components of your body's healing. Stem cells differentiate themselves and ultimately create new tissue and new growth in the body. So those two regenerative medicine techniques and processes are extremely powerful. We've had success with knees and shoulders. One of the things we don't do, but it's also lots of research with stem cells, is even on things like autoimmune diseases and learning disorders, learning disabilities. Autistic kids are getting stem cells now intravenously, and there's thousands of studies. I mean, stem cells is literally just, we're only seeing the tip of the iceberg right now, the research into stem cells. I mean, that's why, when you have a child that they're harnessing the amniotic fluid in the stem cells and freezing it so that the future research, it may ultimately be able to save your life in the future. So a lot of research going into stem cells right now.
Yeah, regenerative medicine is great. As you mentioned, we're really harnessing our body's own healing capabilities. That's really what it is, and we're kind of enhancing it.
Exactly. I think there's a whole shift now. The mindset, I think people, going back 30 years ago, 40, 50 years ago, people just had a mindset that when you get sick, you basically treat the body from the outside in. Meaning, you take medicine, you take a pill, you take a potion, you take a lotion. It's always something that's added to the body. And we're realizing over time that a lot of these medications, I mean, if you do the studies, iatrogenic causes, which means that it's doctor-induced causes of disease, top 10. I mean, adverse drug, people dying from adverse drug effects, top 10 if you look it up. So medications are extremely dangerous. Once again, save lives in many instances, but when we're constantly polluting our bodies, I mean, the average American has 20 different types of medications in their medicine chest. It's even called a medicine chest. In some other countries, they don't even have anything that's called a medicine chest. right? We have just been bombarded with this philosophy that health is created by adding things to the body. And the reality is health, you already have health within you. It's what are you doing to the body? How are you treating the body? You don't need to add things to it to become healthy. Many times you just have to subtract things. So I think people are understanding. I think people are leaning away and they're just a lot more educated on changing their lifestyle versus I think 30 to 50 years ago. People just blindly listened to their doctors. Doctor, you went in, doctor wrote a prescription, and you were on your way. And I think that unfortunately, that was something that they didn't question, and ultimately they pressured the doctors because if the doctor didn't give them a prescription, that was their expectation. They're almost like, oh, I'll go somewhere else and get it if you don't give it to me. So I think now, once again, I think people are more educated. I think you see, whether it be social media or cable news, there's a lot more information that's disseminated. And I think people are just more educated on the adverse effects of medication. I think people question it more than they did 50 years ago. And I think the tide's turning where people understand that health and fitness and maintaining the body is way better than treating the body after it's sick. And I think that regenerative medicine just fits perfectly into that because people understand that the body is a powerful healer, and if you could harness the intrinsic biology, if you will, of the body, the healing properties that are already inside of us, and you could harness those, that's a whole lot better than putting a foreign chemical. Because your body knows it's not foreign. It knows what to do with these. It knows what to do with the stem cells. It knows what to do with platelets. So versus some of these medications are foreign to your body. There's no such thing as, they say that drugs have side effects, right? And the funny thing about that whole concept is it's not a side effect. Think about that for a second. If you take a drug and you have an effect from it, it's cause and effect. It's not a side effect. There's no such thing as side effect. There's cause and effect. If you took a drug and it had an effect, it's cause and effect. It's not, is there cause, effect, and then side effect? It's no such thing. It's something that was created by the pharmaceutical industry. It's just a concept. Just because you take it, so you take a drug and you always have an effect. Now, just because you don't drop dead or you don't get a headache or you don't get hives or a rash from it, something that you don't see, that doesn't mean there's not an effect. People just cause they label these unwanted effects as side effects. And I always found that to be a very interesting concept. Once again, there's no such thing as cause, effect, and side effect. There's a cause and there's an effect. So, I hope that makes sense.
That's right. It's really a direct effect.
Exactly. People use side effect as just an unwanted effect, right? That's really what it is. There's cause and effects, some good effects and some unwanted effects, right? They should actually relabel it. Good effects and unwanted effects. Like, hey, you may have an unwanted effect of this, not side effect. But that's my perception of it, and I think it's pretty accurate.
Yeah, and you mentioned like a lot of times we need to subtract things instead of add things for healing. So we have all these toxic things that we're kind of interacting with, and the more we can decrease that load, it's much more advantageous to healing.
Absolutely. One of my good friends is a very renowned speaker on the topic of toxicity, and he uses the analogy of your body is building up toxins, and picture a jar or a bucket, right? you're just filling your body with toxins, and that is accumulating over time, right? And there may not be a physical effect as you're filling your bucket, but as soon as there's a tipping point at some point, right? That bucket fills, or that jar fills, or whatever that container is that fills with toxins, and now it starts to spill over. Now that spillover is the disease. It's the effect. It's the anxiety. It's the autoimmune. It's the diabetes. Whatever. It's just it's a buildup. It's a buildup of years and years of exposure, bad eating, you name it, and the bucket fills, and now the overflow is ultimately, the situation you find yourself in, whether that be a disease that was self-limiting, whether that be a cancer, whether that be some type of autoimmune issue. It was an accumulation over time. It wasn't something that just happened. It takes a lot of work to build disease in your body. Like I said, this human body is amazing. And like I said, you can smoke and eat bad and not exercise, and some people live to 80 and beyond. But the vast majority, so it just goes to show you, even with all that abuse of your body, it's able to handle it. So you got to really work hard to get sickness and disease. When I'm talking about the ones that we create with our lifestyle, and there's of course those other diseases that are genetic factors and things that are not lifestyle created. So I'm not counting those. I'm talking about the heart disease, the diabetes, and many forms of cancer.
That's right. There's so many things that can cause disease, so it's just kind of like stacking the conditions in our favor. That's what it sounds like.
Exactly.
Another thing you brought up was iatrogenesis. Now, that's a very interesting concept because that's physician-related error, right? And if I'm correct, I believe 100,000 people a year die from properly prescribed medications. Is that correct?
Oh, I believe it's way more than that. Way more than that. If you Google that, it's probably 250,000, but it's well over 100,000.
Yeah. You want to speak on iatrogenesis and like what we're kind of dealing with that? Because what we're basically doing is we're using a therapy that is not really designed for the body to heal, right? And
Right.
It may or may not be necessary, as you mentioned, but a lot of times we're creating unnecessary harm. Is that right?
That's exactly right. That's what Hippocrates. That's the whole medical pledge that they make. First, do no harm. And unfortunately, medicine violates that every day. But I will say this. I have medical doctors that are in my practice. I have many friends who are medical doctors. And everyone goes into medicine with the right intention. You don't go into healthcare unless you really want to help people. And the philosophy that's taught in medical schools is that outside-in model, is that you have to add to the body. You have to cut things out. You have to do things to the body as if we weren't born. I always look at it, when you take a newborn baby as an example, at conception, the miraculous thing that happens, right? The eyes know where to go, the nose knows where to go, the mouth ends up in the right place, there's ears, the heart, the organs, these things. There is nobody helping that. Doctors aren't making that happen, right? That's just innate intelligence at work. That's the body's innate wisdom that knows exactly what to do. And for some reason, as soon as that baby comes out of the womb and is brought into this world, all of a sudden we have to do things to that baby, as if that baby didn't know exactly. It created itself. The creation happened with this wisdom, and as soon as it comes out, there's vaccinations, there's creams, there's lotions, there's vitamin K shots. It's incredible, and like I said, medicine, unfortunately, this is how they're taught. They're just taught that way, so they don't question it. They're just it's just what you see. It's what you're taught. You respect your professors, so you're indoctrinated into it. They want to help people, but that's the methodology that they're taught. And they're never really taught a vitalistic philosophy that, hey, did you ever think that maybe the body knows what the hell it's doing? I mean, it's kind of pretty smart. But like I said, it's the model, it's the medical model. That's allopathic medicine. It's outside in versus inside out. Whereas you have things like chiropractic, which is about removing nerve interference so that the body could express itself. Nervous system controls and coordinates all functions of the body. When there's tension on nerves, the body can't express its health. Things like acupuncture. You're removing energy pathways, you're removing blockages to energy pathways so that ultimately the body can heal. Regenerative medicine, as we mentioned. You're just basically harnessing the healing potential of the body so the body can heal better. So this is the direction. Excuse me, I want a podcast. So this is the direction that I think medicine is going. Once again, unfortunately, like you said, iatrogenic causes. They're always going to be here because there is a yin and a yang of it, right? You have to weigh the pros and the cons of treating disease. You got to ask yourself, is the benefit going to outweigh the risk, right? Because there are instances, as stated, that there's. Do you want to try to save a life at the potential of maybe doing some other damage, right? That's obviously that's a payoff, and that's worth that. Like if it's going to save your life, maybe it's going to cause a major effect, side effect, bad effect, as I But yeah, but most people unfortunately are. You go to the doctor, your blood pressure's high. What's the first thing they're going to do? They're going to give you a blood pressure medication. And why? The doctor doesn't have time to educate you on lifestyle change. He just doesn't. He's got 30 patients on his schedule, 50 patients. It's way easier to write a prescription. Whether it be cholesterol lowering medications, hypertensive medications, putting people on insulin or type 2 diabetes medications. There's just the model is not set up to educate people. It needs to be changed. It should be like the first line. All right, you got high blood pressure. You need to go to this class where our educators are going to go and teach you how the first line treatment is going to be this, right? That makes more sense to me. Not right away. It's just a prescription. And like I said, and unfortunately, a couple of years later, what is it? Increased dosage, second medication. Couple years later, another health problem, another medication, and there you have it. You wake up in the bathroom and you open up the cabinet, and there's your 20 to 30 medications.
That's right. The power that made the body can heal the body.
That's exactly right.
100%, man. All right, Dr. Joseph Cilea, this has been awesome. I really appreciate you coming on and sharing your story with us. I think it can be very inspiring, and I can tell you have a lot of knowledge that kind of goes deep into different aspects of wellness, right? There's certain philosophies around it, and once we start to kind of take on this information for ourselves and apply it, we can really transform our life. So I appreciate you coming on and sharing your insights and your story with us. It's been amazing.
Great, Anthony. Thanks so much. I hope I was of value to your audience.
Definitely. If people want to get connected with you and your work, where can we find you?
Sure. They could email me at jcilea@advanced. That's ADVANCED -wellness.net.
Awesome. Thank you.
You got it. Take care, Anthony.